Thank you, Mayor, Council. Appreciate the opportunity to provide another update. Did want to start off, as we do, highlighting some of the great work being done by our staff. And today wanted to highlight the work of the staff at the Mineta San Jose Airport. Obviously, very unusual times for an airport, and our team's been doing a great job on keeping travelers safe as they do essential travel. And really, every team at the airport has been involved with, really changing the way they do work and changing operations to ensure that the public and our staff are safe. The airport technology team really was responsible for helping all of our employees to be able to, the ones that could, work from home and really help run the airport from home in some ways. The facilities and engineering team deployed safety measures throughout the terminals, including doing a lot of deep cleaning, installing plexiglass guards, and designing and building our own sanitation stations throughout the airport. The properties team helped maintain relationships and connections with all our partners at the airport. This includes the airlines and all the concessionaires. The planning and development team continued to do the work around moving forward with the master plan that the council approved in April. And then the marketing and communications team really did a great job of really through social media and other forms connecting with the public to really instill trust and confidence that our airport is safe. And so I really appreciate the work of the team. We have a very short video we're going to show, and somebody's going to help share that with me right now. So once again, big thanks to our airport team for keeping the airport running during this time in a safe manner. Next, I'm going to hand it over to Kip, and Kip is going to provide an update of what's happened in the EOC over the last 2 weeks. If you remember, we didn't give an update last week. Also provide an update on testing work with the county and where we are in terms of looking ahead at the reopening process. Kip?
Thank you, Dave. Good morning, Mr. Mayor, City Council, members of the public. Kip Harkness, Director of the Emergency Operations Center, along with Lee Wilcox, my co-director, and representing the approximately 575 people who are actively engaged in emergency operations and response. We'll give this brief report out on the Emergency Operations Center activities. As always, our work focuses on our roadmap of ensuring compliance with the public health order, continuing our essential city services, supporting those most at risk, and supporting our own people so they can do all of the above. A couple of highlights: food distribution continues as a priority. Overall, we are not seeing any major shortages or gaps, which is huge and important. We see an overall 4% decrease actually in the amount of food distributed as demand slows at school sites and senior nutrition sites. Additionally, staff from DOT, PRNS, police, as well as the council offices and the mayor's offices participated in an event with our partners, the TAP Foundation, and distributed over 6,000 meals at 3 locations around San Jose. On the housing front, we've completed design and broken ground at the Rue Ferrari and Evans Lane housing sites. Together, the 3 housing sites that we're working on represent a total of 228 units with common kitchen, laundry, and other support facilities. So these sites will provide additional short-term shelter to unhoused residents so they can meet statewide and local shelter-in-place orders to prevent the spread of COVID-19. We also, as people know, transitioned out of the trailers and transitioned those residents into motels and other shelter arrangements as appropriate. On the Beautify SJ front and the EOC branch cleanup, we've stood up a branch within the Emergency Operations Center that's focusing on cleanliness, both around homelessness, encampments, and as well as the protests in downtown, making sure that we're able to keep those areas clean and safe for the people who are there. And in addition, you'll be hearing later on several items from us on the digital inclusion and as well as the extension of the emergency proclamation. Quick update on the county orders. The county orders were updated on the 10th of June. These orders primarily focus on healthcare providers and, to oversimplify, broaden the definition of people who can be tested to make sure that all symptomatic people, regardless of age, hospitalization status, and others can be tested, and make sure that the healthcare facilities are providing testing essentially for anybody with or without COVID symptoms who are at increased risk. So this mandate from the county is intended to make sure that the existing healthcare providers such as Kaiser and others are pulling their full weight in the testing, and that the public testing sites that are stood up that the county is leading and we are supporting on are available primarily then for those who lack healthcare or access to those sorts of facilities. So that's the most recent update that went into issued on June 10th and went into effect on June 15th. So continuing on the theme of testing, as you know, we support the Verily testing at the PAL Stadium, and we have seen those testing numbers rise initially to very promising about 350 a day. And then since the beginning of June, coinciding with the beginning of the protests, we've seen those numbers drop and stay lower, more around the 150 a day range. We have a couple of different hypotheses for these. One is perhaps related to the protesting. The other is related to greater availability of other testing sites, including pop-up facilities at La Tropicana and other places that the county has made availability. However, we are doing an enhanced media push to let people know that testing here and in other places is available. It's free, it's asymptomatic, anybody can be tested, and essential workers or people who've been in close contact or been at the protest should go ahead and get themselves tested. But we are concerned that these numbers have dropped. Continuing on the testing update, we've been in conversations in collaboration with the county around how we support them in their testing mandate. So we've provided support around messaging to amplify the pop-up locations that they have had, including the one ongoing today, I believe, at the SAP Center. We've promoted testing through first responders, either Verily or within their respective health plans. We've provided water and other refreshments at pop-up testing sites when requested. And we're evaluating the ability to support them either through bilingual greeters, expanding some mobile testing, or expanding Verily sites if we can get the number up to a same-day walk-in facility. All of those require us to have some agreements with the county, which we are in conversation with them now about putting those agreements in place. We're also exploring a small-scale pilot around wastewater testing that might provide useful information on levels of infection in certain neighborhoods or facilities. It's at a very, very preliminary level, and we won't know for quite some time whether the data from that pilot will actually be useful as a tool of understanding the progress of the disease. So just to give a sense of what it takes to stand up at the PAL Stadium, in addition to all the good work provided by the Verily folks in the testing, including 5 on-site medical folks for intake, we are providing traffic through our Department of Transportation staff, about 4 to 5 people, to ensure the safe flow of traffic around that site, and the site operations lead also provided by Verily. We're going to be shifting from city staff, which we will continue for the next 2 weeks, over to an existing city contract that will take us through about the next 90 days at that site. After that, during that time, we'll be evaluating our options to see how we might extend it. At this point, the Verily contract with the state expires on the 31st of August, and we don't know whether that contract will be extended or not. But we'll be examining our options in the case that that contract is extended so that we can continue to support these important services on the east side of San Jose. One of the things that has also been discussed previously and that we have been evaluating is the possibility for a new site for walk-in same-day tests. Now, at the Verily site, you can walk on, but you have to have pre-registered. In order to have same-day walk-on capacity, you need to have a core of staff available that are medically qualified, or at least qualified to work under HIPAA regulations, and also have the language abilities to help people register and then get them tested. We believe that while that's possible to do at the PAL Stadium, that would be better done at a site that's more pedestrian friendly and would be better done in collaboration with a community partner. So we have taken the initial steps to put out a potential bid for that. But prior to going out with a bid, we would need clarification and agreement with the county, and also direction from the state to Verily to expand. We would then put out the bid to procure a partner, finalize and execute an agreement with that partner, and stand up that site. So we are quite a ways out from that. The two biggest points at this point that are holding us back. One is that we have yet to sustain and reach the threshold at the existing site that would allow Verily to expand. And two is that we need both agreement with the county and direction from the state to do that expansion once we reach that threshold. But we're doing the research required on what a procurement would look like to provide that if we are able to increase the threshold and both get direction from the state and agreement with the county. We've done some rough estimates of cost, and you have a sense here that the weekly cost would be about $25,000. So over a 90-day duration, that's about a $300,000 cost. Part of the reason that we would want to be doing the agreement with the county and clear direction from the state is that would enhance our ability to seek reimbursement from FEMA. It would not guarantee it, but would increase our chances of seeing some of these costs reimbursed. So this would be on an expanded site with a community partner, and this represents the total cost for all of the support that would be needed in addition to the work that is already provided by Verily in their contract with the state. So moving on to a new topic, I know all of us are trying to understand and figure out how we're moving back into something resembling normal. We're now officially in what we call stage 6 in our 10-stage plan. And we have begun to reopen a number of city services, and we'll be reopening more in the weeks to come. You know about our plans around childcare throughout the summer in compliance and child recreation in compliance with the orders. And we are evaluating a range of services that we can open up and how we can open them up safely. And we'll be doing that in an iterative fashion over the next several weeks and into the summer. So the work of the summer will be both making sure we can do that safely and figuring out the priority of which things are opened up first within our stages 6, 7, and 8 progression, where we now find ourselves squarely in what we call stage 6. The framing we have on that is this notion that we've found central, which is powered by people. And that we at the heart of it, we need to make sure that our workers who return can do so in a way that is safe, healthy, and maintains their well-being of the workforce. In order to do that, 2 wraparound capabilities that we are building is our drive to digital. If you can't hug each other, you can at least hug your computer. And the digital tools that we use have become increasingly more important as meetings like this one demonstrate. And so we need to make sure that as we return to work, we do as much of that work possible remotely, digitally, and safely so that we do not have to, we can minimize the amount of face-to-face interactions. Second framing principle around safety is teams. Teams have always been important. They're always core to the work we do. Rarely is anything in this city done by a single individual. It's almost always done as a team. As we move to more digital and more dispersed work groups, we need to place more intentional effort around teams to make sure that they're able to work effectively. And that's actually more difficult to manage a remote team than it is to manage a team in place. And so we need to be training, skilling, and providing tools and support around not just digital, but also teams as we return to work. And then as you can see in the outer ring, there's a whole host of concerns and needed work around engagement, communications, training, data analytics, the tenant improvements, the things you saw with the airport video, everything from the plexiglass to the directional signage, making sure that we're taking into account diversity, equity, and inclusion in the work we do, working with our union partners, continuing to provide personal protective equipment and face coverings, and then new and modified policies that are all in alignment with this. Got into the weeds a little bit more than we normally do, but I wanted you to understand that it's a body of work led by Kelly Parmalee as the Assistant Director of HR in coordination with our Public Works Department and the EOC that is working through all of these complicated and difficult questions. With that, our work continues, and on behalf of, again, the approximately 575 people fully dedicated to the emergency operations at this point, I want to thank you all who have been part of that work, and turn it back over to Dave Sykes, the City Manager, and to for any questions or comments that you might have as City Council and public. Thank you.
Yes, thank you, Kip, and thank you, team. And Mayor, that concludes our presentation, and we're available for questions.